Hello and welcome. Today we're diving into a topic that's incredibly important but often goes undiscussed: deep pain during intercourse. It's a real issue for so many, but it's frequently misunderstood or worse, just dismissed. So let's get some much needed clarity.
Right. Let's start with probably the most important thing you'll hear today, a direct quote from our source material at the Women's Health Clinic. This pain you might be feeling, it is absolutely real. It is not in your head. It's your body sending a very clear physical signal that something deep inside your pelvis needs a proper medical look. And to help us navigate this, we're leaning on the incredible expertise of Dr. Farzana Khan. Her clinical insights are really the foundation of this entire explainer, giving us information that's both authoritative and, compassionate. Dr. Khan brings more than 2 decades of real, dedicated medical experience to the table. I mean, you can see it here, from her medical degree way back in 2003 to specializing in sexual and reproductive health. And now she's actually training other doctors. Her entire career has been zeroed in on understanding and treating these really complex issues in women's health. Okay, so let's get down to basics. When we talk about deep pelvic pain, what does that actually mean? Well, there's a medical term for it, and just knowing the name can be a huge first step toward getting the help you need.
The term is deep dyspareunia, but honestly, the name isn't the most important part. It's the feeling it describes. This isn't about superficial pain at the entrance. We're talking about a pain that's felt way deep inside. Maybe it's a sharp stabbing feeling, or a dull ache that just hangs around, or even that really distinct sensation that something inside is being, bumped. And here is where Dr. Khan's insights are just so valuable. The specific kind of pain you feel, it's not random. It's actually a clue. It's your body's way of trying to tell you what the underlying problem might be. So just for a second, think about your own experience. What does that pain actually feel like? Because really honing in on that specific sensation is the key to decoding the signal your body is sending. This is just fascinating stuff. Look at how these different sensations point to completely different issues. A sharp stabbing pain on impact, that often suggests something structural, like a tilted uterus, where the cervix is literally being hit. But what about a heavy, dragging ache that lasts for hours after? That's more of a classic sign of a vascular issue, like pelvic congestion syndrome, where blood is pooling in veins. And if it's more of a burning feeling, or it feels like you constantly need to pee, the culprit might not even be your uterus. It could be an inflamed bladder. And believe me, those are just 3 examples. The list of potential causes is pretty long. We're talking about things like endometriosis, cysts, fibroids, scar tissue from old infections or surgeries, even issues with the pelvic floor muscles themselves. The main takeaway here is that this is complex, and that's exactly why a one-size-fits-all solution just doesn't cut it. To really wrap your head around what's going on, it can be super helpful to visualize the anatomy. So let's take a quick look at the internal mechanics that can cause all this trouble. Okay, this slide shows a really crucial concept. In a healthy pelvis, your organs, like your ovaries, have some room to move. They can kind of float and slide out of the way. But when you have something like endometriosis or scar tissue from a past surgery, it can create these things called adhesions, which basically act like glue. They can fix an ovary in place, so it can't move. It just gets hit, and that causes a very direct, very real pain. Now, this brings us to a really common and, frankly, a really harmful myth. So many people are told, or just start to believe, that if they could just relax more, the pain would just magically disappear. But the reality, as Dr. Khan makes crystal clear, is that this just isn't true for structural problems. Sure, relaxation is amazing for muscle tension, but it can't fix adhesions. No amount of Zen breathing is going to unstick an ovary that's been glued down by scar tissue. This is not a failure to relax. It's a mechanical problem, plain and simple. Okay, so we've dug into the problem, we've busted a major myth. Now let's pivot to the most important part, the path to actually feeling better. What are the solutions? What can we do? So while you're figuring things out with a doctor, there are absolutely practical things you can do at home. Things like changing positions to control depth, or using a pillow under your hips to change the pelvic angle. These can make a huge difference. And of course, open communication is key. But that last one, keeping a pain diary, that is pure gold for your doctor. It helps them see patterns you might not even notice. And then, once you have that all-important diagnosis, a whole world of targeted medical options opens up. This is why getting that proper assessment is so critical.
You see, the treatment has to match the cause. You can't just throw physiotherapy at a hormonal problem or hormones at a structural one. It has to be the right tool for the job, whether that's specific hormonal therapies, antibiotics, highly specialized physical therapy, or sometimes even surgery.
Lastly, and this is so important, we have to cover the urgent stuff. While most of these conditions need a doctor's appointment, some symptoms are your body's way of screaming that you need help right now. Please take a really close look at these red flags. If you have that deep pelvic pain, and it's combined with any of these, a fever, heavy bleeding, sudden and really severe abdominal pain, vomiting, or fainting, you need to get urgent same-day medical care. These can be signs of a serious medical emergency, and they should never, ever be ignored. So let's end on this really powerful idea. Your pain is a signal, it is not a life sentence. It is a message from your body, and it deserves to be heard, to be investigated, and to be understood. So the real question is, are you ready to listen?